On page number 31. And I want you to look in the back on page 100 in the back. In the back you guys have page 100. 101 is the last page. On page number, do we have 100?
Yes.
Yeah. Page 100, types of coping mechanism. I would like you guys to look from here in page 100 because they have example. So write down here, go on page 100 and let's go on page 100, okay? Because we don't need to repeat the time and we know very well by example. So let's go on page 100. And in page 100, compensation, the meaning, so when you know the wording, you will understand what they're trying to say. What are you compensating? Extra effort in one area to offset real lacking in one another. So you're lacking in your personality. But what are you doing? You're compensating in another. Example, short men become more assertive verbal and he excel in business. So short guy who are very rich and very good in business, people don't look, you're short, but what are they saying? Oh, he's a very, so what are you compensating? You know there is something wrong in me and you're doing in one area so good that you compensate to get the attention of the people. Are we clear? That is the main compensation. One is low, you're going one higher. Remember like that, you're compensating. Number two, conversion, very important for your test. And everyone should know conversion is a mental conflict. There is a conflict. And what does the patient here is expressed through physical. Underline the word, they complain. They make themselves sick by physical problem. Example, woman become blind after seeing her husband with another woman. The wife saw her husband is with other lady, and what does she say? I don't know, I can see because I'm blind. I never saw. Are we clear? So what are you doing? Conversion. What is conversion? Something you don't want to agree or you don't want to do. What are you doing? You are converting your problem in physical. Are we clear? So whenever someone is saying, I cannot go and witness, I'm a blind, I cannot hear, I cannot tell you, that is called what? Conversion. You are converting your problem. Denial, we all know. Treating obvious reality factor are thought they do not exist because they are consciously intolerable. Denial means you're refusing to accept the truth. For example, mother refuses, her child has been diagnosed with leukemia, or she just had a flu. Are we clear? Accepting cancer, you have a heart problem, you have this diagnosis, patient says, I don't think so I have, I don't feel sick, right? Maybe you have done wrong. And denial, we all should know, conversion means physical sickness. Denial means you are refusing to accept that diagnosis or the problem. Displacement is transferring unacceptable feeling aroused by one object to another and more acceptable substitute. So what is displacement is adolescent lashes out at the parents after not being invited to party, transferring unacceptable way. Now, you are displacing your anger in different ways. For example, I'll give you, you have here adolescent lashes out at parents not being invited to party. They are getting angry, but they're doing in a different way because they have not invited. For example, you scold a child, and what happened? Your child get upset. He goes upstairs and he banged the door and he pushed the door hard. They didn't tell you. They didn't scolded at you. But what did he do? His action, he is taking out his anger. How? By pushing the door, smacking the door, and that is called displacement. What is displacement? Acceptable way. Unacceptable if the child is start arguing and child is getting upset. That would be different way when they're talking to you. So sometime when we cannot do, we displace our feeling in another way. Are we okay? So that is called displacement. Disassociation. Walling out specific out of the personality from conscious. Adolescent talks about feeling great. Disassociation. as they have belonged to someone else, jokes about and love them. These are not my grade. They made a mistake and is laughing. So what is disassociation? You are not agreeing and you are making a fun. That is called disassociation. A lot of time they use this word disassociation for your personality, for your patient. Why? Because they don't accept they're sick and they don't want to be with that people and they disassociate. So that is called disassociation. Fantasy, conscious distortion of unconscious wishes and need to obtain satisfaction. A student nurse failed in critical care exam, daydreaming about heroic role in cardiac arrest. Fantasy. You cannot do it, but you're fantasizing yourself. So fantasy word is always remember you are in a daydreaming. Fixation is strange in level of emotional development in one comfortable situation. Now that's not very important to know, but if you want to read it, that's good. Identification is good. A lot of patients and a lot of us we do. You are subconsciously attributing, so go on page 101, on self-quality of other, like you are impersonating Elvis Presley or Michael Jackson. You are showing yourself, I am Michael Jackson, I am Elvis Presley. So what is the word is called? Identification. You are trying to become Elvis Presley. Are we clear? That is called identification. That is important for your test. Intellectualization, thinking idea or intellect to avoid emotion. Example, parents become extremely knowledgeable about child diabetes. What does intellectualization mean? That you want to know more about. Intellectual means intelligence. Mother learn more about how to treat their child diabetes and they learn more and more. Intellectualization. Intellectual means intelligent and you're getting more knowledge. That's a good word. Projection. Unconsciously projection one own unacceptable quality of feeling unto other. Woman who is jealous of another woman will accuse her of being a gold digger. What is projection? Somebody who is very rich and someone is very jealous of her, and in another way she's saying she's rich. She said, oh, she's a gold digger, right? She's collecting more money by anyways, not by working hard. So that is called your projection. So projection means unconsciously projection on unacceptable quality. You are accepting but unacceptable is not a good way, but you are projecting. Rationalization, justifying behavior, emotion, motive, consider intolerable through acceptable excuses. I didn't get choose for my team because the coach plays favorite. So what is your rationalization? For example, you don't pass in the test and you might say, oh, my teacher was bad. She never taught us this, we never heard this, but came in exam. So what are you doing? Your failure, you are putting in what? Rationalization. So that is a word. You are compensating your weakness into, you want to rationalize. Are we clear? Reaction, that is good. Rationalization is good. Reaction formation, expressing unacceptable wish or behavior by opposite and overt behavior. Recovered smoker and preaches about danger of second-hand is smoking. A person who was a smoker, he is preaching about second-hand. That is a reaction formation. Regression, you should know. Regression is earlier and comfortable emotion. Underline the word emotion and feeling. What are you depressing? You're feeling. 4 years old insist on climbing onto crib with the younger sibling. So you're regressing and your emotion by what is you are regression, you're going backward. So what are you doing? You're regressing. Child who is already toilet trained and they are peeing. Are we clear? Child who shouldn't be going back in a crib, going back in a crib. So what is that? Regression. You're going behavior. So what are you doing? You're behaving and you're showing that you are backward. Are we clear? You need help. And it is a mental health problem. Sometime when you don't get attention, people start doing it. Especially regression come when the mother puts the child in the hospital, or patient goes in a hospital. The man who was feeding himself and bathing because he feels his family put them in a hospital, and he starts saying, I cannot feed, I cannot take bath, you have to bathe me, because they want more attention. So these are, the word is called defense mechanism. We want to live in society, but we are defending our mental problem in different mechanism. We all are not normal. We all have something and somewhere, but when you are going in extreme, then you become more mental health. Are we clear? But we got to protect our body, your mind and our stress to go in a different way, acceptable way, where people accept you and they recognize you. So that is why it's important. What is reflection? Unconscious, deliberately forgetting. Underline the word forgetting. That means your mind don't want to think. Painful thought. Somebody cheated you. You don't want to think about it. So what are you going? You don't want to talk about that, and you are repressing. For example, adolescent forget appointment with counselor to discuss his final grade because he don't want to think about his grade. Are we clear? Next is, so everyone, regression is good, repression is good, rationalization you should know, identification is good, sublimation is the last one, is forgetting about the counselor to discuss final grade, acceptable area. Young woman who hated school because of the teacher is called sublimation. Now these are your defense mechanism. I will finish this one also, then we'll go back on the next page. But let's go, Kubler-Ross is the first 5 stages of death and dying, and write down the word grieving process. Sometimes the wording is not death, but they're saying grieving process. What are the word is called denial, is called dabda. Remember the word D-A-B-D-A. So what is D means? Denial. You don't, unconscious avoidance. What is denial? You refuse to accept. Are we clear? Second, allow one to mobilize defense, and also patient is denial. So what is denial means? You are refusing to accept. That's all you need to know. Patient is going to die. Patient has a cancer, they deny. I don't have a cancer. Family member know the patient is dying, and they come and tell you, how is my mother is doing? Is she walking okay? Is she feeding okay? What does it mean? They're denial. Number 2, anger. What is anger? Your patient gets angry, expressed to rationalization of loss. So anger means they're getting angry, somebody is lost or diseased. Bargaining. What is bargaining means? An attempt to change reality of loss. Person bargain for treatment, control, express, wish to be alive for specific event in new future. Underline that word. Asking time to live. My daughter is graduating. My daughter is getting married. God, give me a time to live. So we are bargaining between our death and the time to live. And we all know, the person realizes I'm going to die, but they're bargaining. Then, so that stage, they're bargaining. And unrealistic activities, event, and depressive. What happened in depression? They become sad, they're quiet. Acceptance, resolution of feeling and death or other loss and result in peaceful meaning. Now they have accepted, they're laying, and they have no problem because they already know their diagnosis, they know what's going on with them. We already have done this part, so this whole page is covered. Let's go back where we left it. And what was the page? 31. 31? Okay. So let's go back. So this is good, same thing. And underneath, dying patient, denial, anger, bargaining, depression, and acceptance. So we finished that on page 100 and the other pages. Now I'm going to go bipolar question. What is a bipolar disease is, underline the word flight of ideas. That means their ideas are changing too fast. And agitation, underline, they're agitated, easily stimulated by environment. They get easily affected by environment. So remember, your environment should be quiet environment for them if you have a bipolar. So remember, one word is flight of ideas, and remember, they're going in extreme change in mood. Write down the word extreme change in mood. Either they're too depressed and they're too happy. So they go very fast, too busy, too happy. And maybe all of a sudden they can go in depression. So what is it? In your question, maybe extreme changes in mood or flight of ideas are bipolar patient. Second line, I will go sexually in distract, easily stimulated by environment, maintain contact with reality, underline the word elation in defense against underlying depression. So they go is all of a sudden mood goes very high. Manipulative, highlight that word. All your bipolar patients are manipulative. And also poor self-esteem, underline the word poor self-esteem. They don't feel they're worthy, whatever they're doing. So they have poor self-esteem. And add their spending money. They spend money a lot because they are in not controllable emotions. So they keep on buying this, buying that, and buying this, and doing this. Are we clear? So they love to spend money, love to do things more to keep them busy, but all of a sudden either they're very hyper or they are under depression. So your questions are, very important word, flight of ideas. Elation in defense mean there changes in mood. Manipulative word, poor self-esteem word, extreme change in mood, spending money. Those are many questions. You will do it, you will find these answers. Next thing is bipolar patient. What do you do if you're dealing with bipolar patient? Number one, physical need, meet the physical need. That means they're not eating, they're not sleeping good, maybe they're not bathing. So help them to give them food, maintain their physical needs. And underline the word environment. Very important, avoid hazards environment because they're so busy, they're not thinking anything and they can fall when they're in extremely mode. So safety. Next thing, distract and redirect energy. They're very busy. Redirect, let's do this, can we do this? So what do? You redirect their energy level. Set limit, the bipolar patient, they are manipulative. All your manipulative, set limit mean what they can do, what they cannot do. Are we clear? You got to. All your mental health questions, set limit is a good answer. Environment safety is a good answer. ADLs are good answer. Administered bipolar patients are medication, lithium. What do you give them? Lithium. Also, you will give them, what is the normal level of lithium? 1 to 1.5, no more than 1.5. Very important for your Nclex, lithium. Bipolar drug. What do you teach patient to drink here? Water and take salt. Remember, give them water and salt. What happens if they are toxicity, vomiting, diarrhea, and ataxia and weakness? Avoid competitive game. Don't put them in competition. Finger food is good. Add there simple directions. Give them simple direction. Don't make it very hard. Whatever you are telling them, they can understand. Take them for walk or keep them busy in activity because they have energy level. So instead of what they're doing, let's go for a walk, let's do exercise. Give them and take out their energy. Increase calories in food. Milkshake is good. Finger food are good. Give them food. So everyone, bipolar patient, we must know bipolar, lithium, side effect of lithium drug. Bipolar patients, you are affecting them with their extreme elevation of their mood. Either they're depressed or they're very happy. Schizophrenia patients remember, bipolar and schizophrenia patients are psychosis. I want you to write down the word psychosis, mental problem, and they have hallucination, and delusion. So write down the word hallucination and delusion. Hallucination is sensory perception. The meaning is they are hearing the voice. They are smelling in the room. Something is burning. Don't touch them. They feel touch. That's your sensation. Tactile, the taste. Food has been poisoned. Are we clear? So what is hallucination? Is perception of sensory. They start feeling. And what is delusion? False idea. Are we clear? Delusion means it's not true. False idea. And remember, when you have false idea, you don't trust anybody because you may think somebody is not good with you, they're doing this, so you become more negative. In both answer, do not force your patient, do not force for their hallucination, and do not agree with them. Are we clear? Reality is very important. So when they use the word psychosis, psychosis is a hallucination and delusion. What is hallucination and delusion are not real. So why you're going to talk to your patient? What are you hearing in the next room? And you're going to say, I don't hear. You may be hearing, but don't say there is nobody in the room and you're lying and there's nobody's talking about. So don't make them feel bad. Your answer should be good, that you're telling them, I don't hear, but you are hearing and we can get you some help. Are we clear? Or there are people who do hear and there's nobody in that room and I'm not hearing. That's okay. But don't tell them and don't fight with them and don't tell them to explain a whole lot of that. So everyone should know schizophrenic patients are psychosis. Bipolar patients, psychosis. What do they have? Delusion and hallucination. Are we clear? And also, I will ask you first underline, then I will add few wording here. Withdrawn from relationship and the world. They're not with the world. They're not with the people. They're not normal. So they're withdrawn. Underline the word withdrawn. They don't know what's going on. Inappropriate display of feeling. Underline the word inappropriate. What is not true, what is not right, they're going to express. Next is hypochondria. What is hypochondria? That you're sick and they feel they're sick. Suspicious, very important word, suspicious. When you are delusional and hallucination, you become what? Suspicious. Somebody is going to kill me, somebody is going to harm me, somebody is after me. So what are you getting here? Delusional and suspicious. Inability to test reality. They're not in a real world. Are we clear? So very important, schizophrenia are totally psychosis. They're not real world. Hallucination, delusion, false belief, we already wrote it down, highlight there. And underline the word persecutory. Highlight that under delusion, fourth line. What is persecutory? Someone is going to persecute me, kill me. So they may give you, patient is saying they are having persecutory idea. What are they are? Schizophrenia. I want you to underline the word hallucination, delusion, persecutory word comes in exam, and their believing is somebody is going to come and get me. They're calling and they will come and kill me. Someone is coming behind me and they're going to harm me. So everyone comes in their mind is what they're going to harm them. That is the meaning, persecutory thing. And they are not real, but it comes in their mind. Next word is loose association. They cannot connect anything. We are talking in one topic and we can go. They're talking one topic here and they jump from one topic to another topic. Loose association means no connection between their thoughts. Next is short attention span. They cannot sit down and listen and meet. Underline the word nutrition and hygiene. What is nutrition and hygiene? ADLs. So you got to remember your patient comes in and they're giving you a question. Patient did not eat food for 1 month. and patient is not taking shower, what do you do the first thing? Give him food, give him maintain ADL, read your question, what they are saying. But what do you do all that answer? When you know lot, you can pick up the answer, maintain ADL, because they're not doing. Give routine ADL. Underline the word regression. They're going backward. Maybe they're wetting their beds, regressing. Now I want you to write down also few words is flight of ideas. Their ideas are jumping. So some of you who have not heard it, make sure you add that. And I make sure that you are adding so you know something in mental health. Flight of ideas. They're talking one thing and they jump into the other topic. Word salad. Word salad means is mixture of word. Mixture of word. Word salad. So they might throw this personality and you will pick up the answer. They have word salad. Very important, the word I'm writing, echollial. E-C-H-O-L-I-A-L-I-A-L. Echollial is repeating speech. Repeating speech. They hear the word and the word from somebody and they are repeating. Are we clear? Maybe I'm going, I'm going, I'm going, I'm going. Hours and hours they will talk this word. Echopraxia word. Echopraxia is movement, removing movement, physical movement, moving their hands, and they see something jumping, they start doing that. So it came in exam, and I want everyone in your question, comes in all the time. So what do you know is your flight of ideas, word salad, the hallucination word, delusion word, and also loose association, short attention span, regression, and they're not real. Are we clear? Now also is confabulation. They use a lot of word, is confabulation. What is the meaning? Confabulation, filling up the memory gap. Filling up memory gap. What is the meaning is here, they don't remember, but they're trying to fill up the topic, and they keep on talking, but doesn't make sense. That is the meaning, confabulation, is filling up of memory gap, and they are like in a fantasy. They keep on talking. They don't want to show they're not right, but they keep on talking, and they're going in there. And blocking cessation of thought. Write down the word, they block. Blocking thoughts. They cannot think. Now you know a person who has this problem. What are you going to do for your schizophrenic patient? Will go, but let's go in a middle box. Type of schizophrenia patients are disorganized. They are disorganized. Inappropriate behavior. Underline the word inappropriate. They're not behaving properly. Then you will go on, is on second one, catatonic. Write down the word waxy personality. What is waxy? Like a wax. They're not moving. They're laying. Catatonic. They're not responding. So they can use the word catatonic. They can use the word is mutism word. Mute means they're not responding. And what do you do for them? So they're laying. They're okay. They're listening, but they don't do anything. They're laying. Their eyes are not blinking, and you may be scared. What happened to them? And you go in the room, and they're laying and staring, and they're not moving. You talk to them, they no answer. That is called catatonic. And also, some question, they throw the word waxy personality. Paranoid, suspicious. They don't trust anybody. Now, what do you do for schizophrenic patient? Your question. Your questions are going to be the wording. Echopraxia word, this word, catatonic word, paranoid word, delusion word, hallucination. So if you understand, you are good. Now, what do you do? Number one, safety. Put them alone in the room. They don't trust. They feel everybody after them. So don't put them with somebody else. Alone room, safety is important. And any kind of behavior they can do, monitor for safety. Hallucination, delusion, don't argue. Validate reality. I am not hearing. You may be hearing. I see the clock. You may see the snake. Are we clear? So what does it mean? That whatever you are saying correctly. Respond to feeling tone, never further discuss voice. Don't tell them, tell me what are you hearing. Tell me what are your voices are telling. Are we clear? I don't ask to tell more about voices. With delusion, don't argue. So never argue, but you be real. That's important. Physical needs, ADLs, maintain them, give them routine, remind them every day, shower, remind them what they're going to do. Next is engage in group or family therapy. What are we doing here? Group therapy and family therapy. Put them. Once they stabilize, then you put them. But when you're admitting them, don't put them in a group therapy because they don't trust. They're not going to be. Family member come one-on-one when you're admitting them. Encourage client for nonverbal behavior. Accept regression. Simple activities are important to give them. And medication. Next thing is they do need medication. So everyone understand bipolar word. Everyone remember that for your Nclex lithium, normal lithium level, side effect of lithium toxicity. Next I'm going to move paranoid. Paranoid people are suspicious. They are cold because they don't care. Quick response. Paranoid people are always angry. Underline the word. Establish the trust. Very important answer for mental health. How do you treat your patient? All your patient, whether it's a mental health, medical, yes, relationship, you maintain them with trust. They can trust you. Medication, phenothiazine, anxiety medication. So paranoid people, to cut down their anxiety, you can give them anxiety medication. Also social situation, structure that they can trust you and work with them. So paranoid word means suspicious. Always remember they have anxiety level, they get angry, give them anxiety medication. Are we clear? Paranoid means they always have a mind to know people are doing wrong and this is what's happening, that's going on, and they're busy in paranoid behavior. Schizoid means the word, these are the wording. They throw in the exam paranoid, so if you understand paranoid word, schizoid means schizoid, shy, introverted. Schizoid means they do things by alone. They don't want to associate with others. So what is the meaning is here, introverted, they do themselves. Mostly of things introverted. They're not extro. Extro means when you are with other people, listening and doing. Verbal interaction, they don't talk much, few friends because they don't trust much. So schizoid means they are very shy people and they want to live themselves. Intellectualization, establish trust, maybe anxiety medication, social structure, social situation. So always remember schizoid people are shy people, they are introjected, try to get them out. Schizotypical are eccentric. And they're a little different. They're more like a psych problem. They are suspicious. I'll underline the word trust, and medication is you give them neuroleptic to decreasing them is psychotic symptom, and also problem with perceiving communication. And that you can accept. Now let me remind you, I have done all in my package these things. So I'm glad you have in this package. You must know the wording, schizoid personality, paranoid, schizophrenia, bipolar. Okay? Lithium is important. Antisocial comes in exam. What is the meaning? Antisocial personality, page 33, is disregard the rights of others. They don't follow rules and regulation. Cheating, stealing, and lying. The lack of guilt. What does guilt means? Lack of guilt. You feel guilty when you do wrong? Remorse. Right? Huh? Guilt like remorse. Yeah. Guilt, what happened when you, okay, let me give simple example. You didn't pass the test and you start feeling guilty. I wish I would have studied more. Right? So what is guilt is? internal feeling telling you you did wrong. But if you keep on telling, I didn't pass because they never taught in school, what are you doing? You're putting your blame on the teachers. Are we clear? So which people are good to live in society when you feel guilty? Everything becomes in your life is normal. Lying is a normal, cheating is a normal, doing things is a normal, then you don't have guilt feeling. Are we clear? So guilty is very important to improve you and to make you a better person. Because what happens, you do something wrong, you cannot live. If I come one day late and my class is 9 o'clock, what do I feel? Guilty. And what do? I come here 30 minutes, maybe an hour early, because that's the way I am. So guilt is very important to improve us. If you have lack of guilty, that means everything is normal for you. And you can live, you can do many things wrong, but you don't feel what is wrong and what is right. So it's very important. You correct the child when they're growing. And this is wrong, you don't do this, this is not right, this is not. Now what happens if you keep encouraging child? Oh, I didn't study because my teacher was bad. So what are you listening? You're listening your child's problem and you're dealing with others' problem. So what happened? You're raising your child with no guilt in them, and that's why we have problem with antisocial personality. They have no guilt feeling and they can do anything. They can cheat, they can lie, and lack of guilty. Immaturity. What is maturity? When you know what is right and when you know what is wrong. You are mature. Mature doesn't mean 90 years old. Some people are 90 years old, but they are not mature. Some people are 15 years old and they are acting like 60 years. What does it mean? The maturity means is you're up here. You are matured before your age. Why? Because you have seen your grandparents, you have seen your mom doing, and you're learning that thing and you become more mature. So see how wording is in our life affect our personality. So that is what the word is called immature. Responsible associate with substance abuse. So they are irresponsible. They don't care. Immaturity. They are antisocial, lack of guilty. They don't feel guilty, something they steal, they kill somebody. They don't feel. Why? Because they have no guilt feeling. Next is, what do you do for, so everyone should remember, antisocial people disregard the law. Are we clear? They disregard, they have no feeling right and wrong, they're immature and they're irresponsible. As I want you to write down, they know how to escape from when they are caught, and cruelty to animal. That comes in exam. They use this wording. Cruelty to animal, escaping from home, stealing. These are the characteristics. So make sure they add the word cruelty, animal cruelty. They enjoy to be cruel with the animal. And they break the rules. They don't follow. And they know how to lie and how to escape when they're caught. They're not, okay, if somebody says, I made a mistake and I'm sorry, what does it mean? That person is going to learn. But if you kept on saying, I never made a mistake and I'm right, what does it mean? You do not accept a mistake and you're never going to learn the right thing. Firm limit setting. Make sure you are firm with those people and set the limit. This is your rule. Come confront the behavior. Let them know you have done this wrong and this is wrong. Are we clear? So if you let the child from beginning know what is right and wrong, they will know the difference. And next you move on, enforce the consequences. Always, it's a behavior. They must know you should pay for it when you do something wrong. Are we clear? So what are you teaching them? Is consequences enforced. If you did something wrong, you will be punished. And that is your punishment. Group therapy, they may need group. So this came in exam. I'll tell you, you guys must know the wording antisocial. Immediately you remember the word cruelty to animal, escaping from home, not to follow rules and regulation. They're very smart, to overcome with the problem. Borderline personality is, underline the word brief, intense, they don't keep relationship longer, brief relationship. Blame others for own problem. Impulsive, manipulative, self-mutilation, underline the word self-mutilation. They make the injury on themselves. They cut themselves, skin problem. And women usually are sexually, so who are borderline personality, who have been sexually abused. Underline the word suicidal. They're suicidal, and write down the word depression. So they're depressed, they have been sexually abused, they're self-manipulating, and also remember self-mutilation word. They cause injury to themselves. What do you do in a borderline personality treatment? Identify and verbalize feeling. Let them talk to them. Empathy word is a good word. What is empathy? You put yourself, what they're going through. Put yourself in the same shoes. Behavioral contract. You got to promise them, we want you to do, and let's make a contract that you're going to do this. So behavior contract. And also consist setting the limit and group therapy. Very important. They need to be borderline personality are needed antidepressant medication and hospitalization. Let me finish these two before we take a break. Narcissistic personality comes in exam. We all should know narcissistic. Lack of feeling and empathy for others. They are arrogant. They don't care about your feeling. Empathy for others. They don't have feeling. And sense of entitlement. Use others to meet own needs. Shallow relationship. View self as superior. Write down underneath, it's all about me. Only they think about themselves. I am rich, I am superior, I can do better, nobody is better than me. So remember the word narcissistic means it's all about me. Are we clear? Everything is me. So they can cover, they can lie because they are the highest. They want everyone to respect them. Everyone to take care of them. They want a special treatment. Underline the word in treatment is mirror what clients sound like. Let them feel what they are saying. Underline the word set limit. Consistency. Whatever they're doing, every time in behavior, consistency. You teach them every day same thing. Are we clear? So because they only think about themselves, let them learn. There are other people, you must learn to respect them. Teach that mistakes are acceptable because they want to be superior, everything they want to do high. So let them know, we all human beings, we can make a mistake, but that's okay. Accept and learn. Historical assessment draws attention to self. It's mostly in female. So add there, very common female, seductive. Seductive means they seduce, they make other people to feel very attractive. And temper tantrum. Outburst, shallow shifting emotion. They don't really love, they don't really care, but they just keep shallow, superficial relationship. Cannot deal with feeling, easily influenced with others, and write down no genuine relationship. There is no really relationship, but they're very superficial. So when they're saying historical personality, think about female person. They're very seductive. They want to show people, but they have nothing in there really what they're doing. Positive reinforcements from centered behavior. Clarify feeling, facilitate expression of feeling. Let them know, let them talk, and that is, see, all we have these personality. Anything goes in exceed, they become what? Abnormal. But the word, antisocial word, everyone should know: borderline, narcissistic, historical personality, bipolar, schizophrenia for your Nclex. And I will still continue when we come back, whatever left on the mental health. So we'll stop here and we'll continue back on page 34.